Joining me right now is former Vermont Governor and former DNC Chair Howard Dean. Sir, it's good to have you with me now. And you may have heard me talking to the congressman there about the GOP sabotage that Politico was talking about, and that's hardly a secret. Part of that campaign has been one of misinformation, being intellectually dishonest about how people are losing their insurance plans. And we've got a couple of articles out today really taking a hatchet to those accounts. The LA Times points out that back in March, Consumer Reports published a study of many of these plans, placed them in a category, a special category called junk health insurance, where some plans the magazine declared may be worse than having none at all. So these points also make that the expecting insurance companies to play fair with their customers is as pointless as expecting dogs not to drink from the toilet. And then Talking Points memo has the bottom line: almost all of them are going to receive the same or much better coverage, and many of them are going to receive financial help to purchase it. Isn't this what Republicans said that they wanted? This is based on a Republican plan. This is making all of us be personally responsible for ourselves.
Frankly, at this point, the Republicans have just become political and nothing else. I find it best to just ignore them entirely. This program is going to rise and fall not on what the Republicans say or do, because their ratings are far lower than the president's. It's going to rise and fall on whether we can get this thing running properly or not. And we just have to focus on that and not pay so much attention to these whack jobs in Congress that are trying to undermine the thing and have forgotten that they actually are supposed to serve the American people. Now, to get to your question, we did this 20 years ago. We had community rating and guaranteed issue in this state 20 years ago, and some insurance companies left. Those were the insurance companies that were taking 50% of your health care dollars and not spending it on health care. Those were the insurance companies that when you were a 35-year-old and you got something really bad, got rid of your policy. And those are the kinds of people who are losing their health insurance. They don't know that they're losing something that's bad because they haven't been sick. And when you get sick and you have one of these policies that doesn't cover this, doesn't cover that, and can be cut off, all of a sudden you find that indeed this is junk health insurance, and there's a fair amount of it, and that's one of the great things about Obamacare. He's going to get rid of that. As
you point out, it's only in those emergency situations that you find out how unprotected that you really are when you go to try to get the coverage you've been paying into. But we have this article from the National Journal. It's one of several calling into question the president's credibility as a result of the promises that he made about people being able to keep their insurance. And on Morning Joe today, Nicole Wallace laid into spokesman Jay Carney over it. I just want to play a small portion.
The public believes your boss, and you know as well as I do, when the public stops believing your boss, he is rendered impotent. So how do you make the public believe your boss when the two things that were said to reassure people that they could keep their health plans and they could keep their doctors turn out to be not true?
So, Governor, the wonk blogs, Ezra Klein, puts this all into perspective for us. A fascinating kind of blame game over the problems with the Obamacare website. You can see where the arrows are pointing there, starting with Republicans in Congress and coming all the way back around to the president. So is the test of the GOP in this sabotage and the blame game going to be ultimately borne out for Democrats come 2014?
Well, you know, that depends. I think right now the odds are with the Democrats. I think the Republicans have essentially eliminated their brand as a serious contention in American politics. I mean, not to say they're going to go away. They're not. But nobody believes anything they say. The problem is we got to deliver this. And it has entirely to do with Democrats. The Republicans are irrelevant to this debate. They can make noise. They can go on cable show. They can pretend they're outraged. We've got to fix this, and we've got to make it work properly. And my hope is that this November 30 deadline for getting this thing fixed is kept. These are hard things. In Vermont, we have our own exchange. It hasn't worked as well as we going to work. It hasn't worked as well as Kentucky's or California's. So, you know, a lot of this is a general problem in the tech industry. You know, these rollouts are big and they're messy. And they're messy in the private sector and they're messy in the public sector. And when you try to do 36 states, they really get messy. So the president's credibility is on the line. Again, I think the Republicans are irrelevant and they're baying at the moon and they're silly. And we all know that they were happy to shut down the entire economy of the world to get their way. Why pay attention to them? Let's focus on what we have to do, which is to fix the website and fix the program. We're probably going to need some paper backups. We've got to get folks signed up. I don't think it's a good idea to delay. I understand senators are worried about their reelection. Let's worry about health care and stop worrying about politics.
November 30th, it's going to be here before we know it. Former Vermont Governor Howard Dean. Great to have you on. Thanks so much.
Thank you.